Top 9 warning signs of blood clots to be aware of. Welcome to our channel. In this video, we'll discuss 9 warning signs and symptoms that may indicate the presence of dangerous blood clots in your body. Normally, your body forms and dissolves blood clots throughout the day. However, if they fail to dissolve properly, they can become lodged in your arteries or veins, obstructing blood flow to and from your heart. This can lead to serious complications such as heart attacks, strokes, or a condition called an embolism, where a blood clot dislodges and becomes trapped in your lungs. If you experience any of the symptoms discussed in this video, it's crucial to seek medical assistance promptly. Please remember that this video is for educational purposes only, and if you have any medical concerns, consult your doctor. 1. Walking cramps, also known as claudication. Occasionally, detrimental blood clots may develop in the veins or arteries of your legs or arms. Certain factors such as smoking, being overweight, or having diabetes can increase the likelihood of this occurrence. If you experience cramp-like pain in your leg muscles while walking, which subsides upon resting, it could indicate a blood clot. These pains typically occur after walking a consistent distance and alleviate with rest. Additionally, you may observe swelling in your legs or arms and notice that the affected area appears red and warm if a blood clot is present. 2. Sharp chest pain, also known as pulmonary embolism. If you experience sudden breathlessness, sharp chest pains, or difficulty breathing inexplicably, it could indicate a blood clot in your lungs. This occurs when a blood clot dislodges from a deeper blood vessel and travels to your lungs, obstructing blood flow. It's a critical situation as it hampers the supply of oxygen to your blood. If you encounter these symptoms, seek immediate medical assistance. 3. One-sided numbness, also known as ischemic stroke. Picture your brain as the command center of your body, relying on a steady supply of blood and oxygen to function optimally. Occasionally, a clot can impede this blood flow to your brain, resulting in what's known as a stroke. This risk is higher in individuals with narrow arteries caused by plaque buildup. When a stroke occurs, you may suddenly experience weakness or numbness on one side of your body, such as your face, arm, or leg. Speech difficulties, comprehension challenges, dizziness, and severe headaches may also arise due to insufficient oxygen reaching your brain. In such instances, immediate action is crucial. Don't hesitate, seek help promptly by visiting the emergency room or contacting emergency services. 4. Basketball belly, also known as hepatic vein thrombosis. Blood vessels serve as miniature highways within your body, but occasionally, clots can obstruct them. If these clots become lodged in the veins of your liver, it can impair its function. This condition may result in a condition known as ascites, characterized by abdominal swelling and tightness, akin to a basketball. However, it's crucial to note that this abdominal issue can also stem from various other liver-related ailments, not solely blood clots. Therefore, it's imperative to consult a doctor to accurately diagnose the underlying cause. 5. Arm pain, also known as coronary thrombosis. Your heart, a resilient muscle, relies on a consistent blood supply. Occasionally, a clot can obstruct a blood vessel connected to your heart, leading to a heart attack. Symptoms may include intense chest pain that radiates to your left arm or even your right, accompanied by nausea, dizziness, and sweating. As this is a serious condition, if you experience these symptoms, seek immediate medical attention at the emergency room. If you find these tips beneficial, I encourage you to demonstrate your support by liking this content, subscribing to my channel, and enabling notifications for the latest health and nutrition tips. 6. Loss of vision, also known as retinal vein occlusion. Imagine the veins in your eyes as tiny pipelines transporting blood. Occasionally, a clot can obstruct these pipelines, resulting in waking up with vision issues in one eye or sudden blurriness. Despite the absence of pain, you may also observe a dark spot in your vision. This condition requires prompt attention, as it could potentially lead to other eye-related complications. 7. Irregular heartbeat, also known as atrial fibrillation. A condition known as atrial fibrillation occurs when your heart beats irregularly and at an accelerated rate. This irregularity can arise from issues with your nervous system. When your heart doesn't beat properly, blood may accumulate in your heart and subsequently travel to your brain, potentially leading to a heart attack or stroke. Monitoring this condition is essential if you are affected by it. 8. Swollen feet, also known as edema. Have you ever observed swelling in your feet and ankles, accompanied by stretched skin? If this occurs, and your skin appears shiny or you notice indentation upon pressing it, it could indicate poor blood circulation in your feet. This condition may increase the risk of developing blood clots, but there are measures you can take to alleviate it. Engaging in regular exercise, supplementing with B vitamins, and ensuring adequate intake of essential minerals can help improve circulation and reduce the risk of complications. 9. Varicose veins. Varicose veins are characterized by blue, twisted veins in the legs, resulting from poor blood flow and weakened vein structure. Elevated levels of estrogen in the body can contribute to their development. Having varicose veins heightens the risk of blood clots forming when blood becomes trapped in these veins, potentially indicating a more serious condition known as deep vein thrombosis. How to prevent blood clots. Our bodies naturally produce and dissolve small blood clots within our blood vessels regularly. However, as we age, become less active, take specific medications, or lack essential nutrients, the risk of developing dangerous blood clots increases. But fear not, we have crucial measures to help prevent these clots from forming. 1. Keep moving. When seated for extended periods, such as during work or on a bus ride, remember to stretch and move every hour. This promotes improved blood circulation and reduces the likelihood of clot formation. Additionally, wearing compression socks during lengthy journeys can prevent blood from pooling and clotting. 2. Serapeptase supplement. There's a beneficial substance known as serapeptase, derived from silkworms. Consuming a pill containing this enzyme can help to thin your blood and break down the solid components of clots. However, it's important to consult your doctor before considering this option. 3. Healthy eating. Consume wholesome, natural foods like vegetables rich in potassium and magnesium. Examples include broccoli, cabbage, and leafy greens, which assist in maintaining fluid balance within your body. 4. Healthy habits. If you smoke, endeavor to quit, and limit your coffee intake to 2 to 3 cups per day. Ensuring adequate hydration and incorporating potassium into your diet can also benefit blood flow and heart health. It's advisable to consult a specialized physician if you're using certain hormonal treatments. 5. Blood pressure. Maintain healthy blood pressure levels by staying active, staying calm, incorporating the herb rhodiola, and consuming nutritional yeast for vitamin B1. Moreover, explore other supplements and foods that aid in naturally breaking down blood clots within the body. If you enjoyed watching this video, don't forget to like, subscribe and turn on the notification bell, so you don't miss any new videos. Let us know your thoughts about this video in the comments section down below, and feel free to stay and enjoy it until the end. Also make sure to check out our next highlighted video, and we will see you next time. Thanks for watching. Please like, share, and subscribe.